together. Breathe in slowly, drawing in calm and comfort, and breathe out, releasing any worry or tension. Today we're going to talk about something that many people are facing: how to repair a damaged skin barrier with patience, gentleness, and effective care. If you're here, your skin is probably telling you something is wrong. Perhaps it feels tight, uncomfortable, or perpetually dry no matter how much moisturizer you use. Perhaps it's become sensitive, reacting to products that never bothered you before. Perhaps you see redness, flaking, or a rough, dull texture. Perhaps your skin just doesn't feel like itself anymore. These are all signs of a compromised skin barrier, and I want you to know, this is repairable. Your skin can heal. You can restore its health and comfort. First, let's understand what happened. Your skin barrier, that protective outer layer made of skin cells and lipids, has been damaged. The protective wall has developed cracks. Moisture is escaping through these gaps, leaving your skin dehydrated. Irritants are entering through these same gaps, causing sensitivity and inflammation. Your skin is vulnerable right now, but with the right care, it will rebuild itself. What causes barrier damage? Sometimes it's harsh skincare products, strong cleansers, aggressive exfoliation, or too many active ingredients used too aggressively. Sometimes it's environmental stress, extreme weather, dry air, pollution. Sometimes it's lifestyle factors, stress, poor sleep, inadequate nutrition. Often, it's a combination of several factors. But here's the important thing. Regardless of how the damage occurred, the path to healing is the same. Repairing your barrier requires two things: stopping what's causing damage and actively supporting your skin's natural healing processes. Let's talk about both. First, you must stop the damage. This is non-negotiable. If you're still using the products or practices that damaged your barrier, you're trying to fill a bucket that has holes in it. The healing can't happen until you stop the harm. Look at your current routine with honest eyes. Are you using harsh, foaming cleansers? Are you exfoliating regularly with scrubs or strong acids? Are you using retinol, vitamin C, or other active ingredients? Are you cleansing multiple times a day? Are you using hot water? Any of these could be preventing healing. Here's what you need to do, and I know it might feel extreme, but it's necessary. Strip your routine down to absolute basics. Remove everything except 3 products: a very gentle cleanser, a rich barrier repair moisturizer, and sunscreen. That's it. Everything else needs to be set aside for now. I know this might feel scary. You might worry that without your acne treatment, your breakouts will worsen. Without your anti-aging serum, your wrinkles will deepen. Without your brightening products, your dark spots will become more prominent. But here's the truth. None of those products can work effectively on damaged skin anyway. The foundation must be repaired first. Everything else can wait. Let's talk about choosing the right products for barrier repair. Your cleanser should be extremely gentle, creamy, milky, or a non-foaming gel. It should clean your skin without leaving it feeling tight or stripped. If you're not sure whether your cleanser is gentle enough, on the side of caution and choose something even milder. Some people even skip cleanser in the morning during barrier repair, using just lukewarm water instead. When you cleanse, use lukewarm water only. Hot water, even warm water, strips lipids from your already compromised barrier. The water should feel neutral on your skin, neither hot nor cold. Massage the cleanser on gently with your fingertips for no more than 30 seconds. Then rinse thoroughly. Pat dry with a clean, soft towel. No rubbing, just gentle pressing motions. Your moisturizer is crucial during barrier repair. You need something rich, nourishing, and specifically formulated to support barrier function. Look for these key ingredients: ceramides, cholesterol, and free fatty acids. These 3 lipids are the primary components of your natural skin barrier. Applying them topically helps rebuild the damaged structure directly. Ceramides are especially important. Look for products that contain multiple types of ceramides: ceramide 1, ceramide 3, ceramide 6-2. The more types, the better. Some excellent barrier repair products are specifically formulated with the ideal ratio of ceramides, cholesterol, and fatty acids to mimic your natural barrier composition. Other beneficial ingredients for barrier repair include niacinamide, which supports barrier function and has anti-inflammatory properties; centella asiatica, which soothes and promotes healing; colloidal oatmeal, which calms irritation and forms a protective film; panthenol, which hydrates and supports repair; and hyaluronic acid, which draws moisture into the skin. Apply your moisturizer generously. Don't skimp during barrier repair. Your skin needs abundant moisture. Apply it to slightly damp skin, ideally within 60 seconds of cleansing, to trap extra water in your skin. Press it gently into your skin rather than rubbing. Consider layering your moisturizer. Apply 1 layer, let it absorb for a minute, then apply another layer. This builds up deep hydration without feeling heavy. Many people find this more effective than applying a large amount all at once. At night, add an occlusive final layer to seal everything in. This could be a facial oil like squalane or jojoba, a sleeping pack, or even plain petroleum jelly. Occlusives create a physical barrier that prevents transepidermal water loss while you sleep. This nighttime protection is incredibly beneficial for barrier repair. Sunscreen remains essential, even during barrier repair. UV damage further compromises your barrier and slows healing. Choose a gentle, mineral-based sunscreen with zinc oxide or titanium dioxide if possible. These tend to be less irritating than chemical sunscreens. If your skin is extremely sensitive, look for formulas designed for babies or sensitive skin. Now let's talk about what to absolutely avoid during barrier repair. No exfoliation of any kind, no physical scrubs, no acids, no peels, no brushes, no active ingredients, no retinol, no strong vitamin C, no benzoyl peroxide, no salicylic acid, no harsh cleansers, no alcohol-based toners, no astringents, no hot water, no long baths, no saunas or steam rooms, no picking at flaking skin, no rubbing, no unnecessary touching of your face. This might sound restrictive, but remember, it's temporary. You're giving your skin a healing period, like putting a broken bone in a cast. Once your barrier has repaired, you can gradually reintroduce other products if desired. But right now, protection and support are all that matter. How long does barrier repair take? With consistent, gentle care, you should notice improvement within 1 to 2 weeks. Significant repair typically takes 4 to 6 weeks. Complete restoration might take 2 to 3 months, especially if the damage was severe or long-standing. Be patient. Your skin didn't become damaged overnight, and it won't heal overnight either. During the healing process, you might experience some purging of flaky skin. This is normal. Your damaged outer layer is shedding so healthier skin can emerge.
Action can also cause micro tears in your skin barrier, leading to increased sensitivity and irritation. For these reasons, dermatologists typically recommend avoiding physical scrubs if you have acne. Chemical exfoliation is gentler and more effective. There are two main types of chemical exfoliants: alpha-hydroxy acids, AHAs, and beta-hydroxy acids, BHAs. AHAs, including glycolic acid and lactic acid, are water-soluble and work on the skin's surface. They're excellent for general exfoliation, improving texture, and reducing the appearance of fine lines. However, they don't penetrate into oil-filled pores effectively. BHAs, particularly salicylic acid, are oil-soluble and can penetrate into sebum-filled pores, making them ideal for acne-prone skin. Salicylic acid dissolves the sebum and dead skin cell plug within the follicle, directly preventing and treating comedones. For acne-prone skin, exfoliating 2 to 3 times weekly with salicylic acid is generally appropriate. Some people with very resilient skin can tolerate daily use, while those with sensitive skin may do better with once or twice weekly exfoliation. Begin conservatively with 2 to 3 times weekly, observing how your skin responds over 2 to 3 weeks before increasing frequency. Exfoliation products come in various formats. Exfoliating cleansers contain salicylic acid and are used during your regular cleansing routine. These are gentle and convenient for daily use. Exfoliating toners are applied after cleansing and before other treatments. They're typically stronger than cleansers and are meant to be left on the skin. Exfoliating serums and treatments are the most concentrated forms and are usually applied 2 to 3 times weekly. Exfoliating masks are meant to be applied for a specific duration, usually 10 to 15 minutes, then rinsed off. When starting exfoliation, begin with a lower concentration of salicylic acid, typically 0.5% to 1%, and gradually work up to 2% as your skin builds tolerance. Many beginners make the mistake of jumping to high concentrations, causing excessive irritation, dryness, and peeling. This leads them to conclude that exfoliation doesn't work for them when the actual problem was starting too strong. The exfoliation process requires proper technique. Apply your exfoliating product to clean, completely dry skin. Applying to damp skin increases irritation and reduces effectiveness. Use your fingertips to apply the product gently, spreading it evenly across your face, paying special attention to areas where acne is most prevalent. Some exfoliating products are meant to be left on overnight, while others are rinsed off after a specific duration. Follow product instructions carefully. During the initial exfoliation period, expect some adjustment. Your skin may experience mild redness, slight dryness, or mild peeling. This is normal and typically subsides within 1 to 2 weeks as your skin adapts. However, if you experience severe irritation, excessive peeling, or significant discomfort, reduce your exfoliation frequency or concentration. Listen to your skin, it will tell you what it needs. Never combine multiple exfoliating products on the same day, and especially avoid combining exfoliants with other strong actives like retinoids or benzoyl peroxide on the same night initially. This overexfoliation damages your skin barrier, causes excessive irritation, and can actually worsen acne. Once your skin is accustomed to each product individually, you can sometimes combine them, but do so cautiously and only if your skin tolerates it well. Some people experience purging when they begin exfoliation, where acne temporarily worsens as the exfoliant brings impurities to the skin surface. This is generally a positive sign that the product is working, and it usually subsides within 1 to 2 weeks. However, if purging lasts longer than 2 to 3 weeks or becomes unbearable, discontinue the product and consult a dermatologist. After exfoliating, your skin barrier is compromised and needs careful management. Moisturize generously with a product suitable for your skin type. Avoid other potentially irritating ingredients like vitamin C, niacinamide in high concentrations, or peptides on exfoliation days. Stick to basic cleanse, exfoliate, and moisturize. Use sunscreen religiously, as exfoliated skin is more susceptible to UV damage. Seasonal variations affect exfoliation needs. During winter, when skin is naturally drier, you may need to reduce exfoliation frequency. During summer, when skin is oilier and more resilient, you might tolerate more frequent exfoliation. Listen to your skin and adjust accordingly. Results from regular exfoliation appear gradually. After 4 weeks of consistent exfoliation with salicylic acid, you should notice smoother texture, fewer comedones, and generally improved skin clarity. Acne lesions should appear flatter and less inflamed. However, exfoliation is most effective as part of a comprehensive acne treatment plan, not as a standalone solution. Guide 4: Salicylic Acid, the Science, Concentrations, and Complete Application Guide. Salicylic acid has been a cornerstone of acne treatment for decades, and understanding its mechanism and proper use is essential for anyone dealing with acne. Salicylic acid is a beta-hydroxy acid, BHA, meaning it's oil-soluble. This oil solubility is what makes it particularly effective for acne-prone skin. It can penetrate into oil-filled pores where other water-soluble ingredients cannot reach. Salicylic acid works through multiple mechanisms. First, it acts as a keratolytic, meaning it helps dissolve the protein bonds between dead skin cells, promoting cell shedding. Inside the follicle, it dissolves the sebum and dead skin cell mixture that forms come-done plugs. Second, it has mild antibacterial properties, helping reduce bacterial colonization within blocked pores. Third, it has anti-inflammatory effects, reducing the redness and irritation associated with acne lesions. Fourth, it can stimulate cellular turnover, promoting healthier skin overall. Salicylic acid comes in various concentrations, typically ranging from 0.5% to 2%. The concentration directly correlates with effectiveness and also with irritation potential. A 0.5% solution is very gentle, making it suitable for sensitive skin or those new to salicylic acid. A 1% solution is considered standard for most people with acne-prone skin, providing a good balance between effectiveness and tolerability. A 2% solution is the maximum recommended concentration for at-home use, offering significant exfoliating power but requiring experienced use to avoid over-irritation. Professional-grade salicylic acid can be applied at concentrations up to 20 to 30% during chemical peels, but these are only performed in clinical settings and are significantly stronger than over-the-counter products. Salicylic acid products come in numerous formats, each with advantages and disadvantages. Cleansers containing 0.5 to 2% salicylic acid are the gentlest form. You use them daily during your regular cleansing routine, and the short contact time limits irritation while still providing exfoliating benefits. Cleansers are ideal for maintaining clear skin and for beginners new to salicylic acid. Toners or liquid exfoliants contain higher concentrations and are left on the skin, providing more potent exfoliation than cleansers. These are typically applied after cleansing and before other treatments, 2 to 3 times weekly. They provide more dramatic exfoliation than cleansers but also carry.
Welcome to this gentle, caring moment. Breathe deeply, filling yourself with calm. Exhale slowly, releasing any frustration or worry. Today, we're going to explore how to reduce blackheads without harsh methods, how to address these common skin concerns with patience, gentleness, and effectiveness. Blackheads are one of the most common skin concerns, and they often feel stubborn and frustrating. But here's an important truth. Blackheads are not a sign of poor hygiene or inadequate cleansing. They're a natural occurrence that happens when pores become clogged with oil and dead skin cells. The black appearance comes from oxidation, not dirt. Understanding this helps you approach them with less judgment and more effective strategies. Let's begin by understanding what blackheads are and why they form. Blackheads are open comedones, pores that have become clogged with sebum and dead skin cells. Unlike whiteheads, which are closed beneath the skin's surface, blackheads are open to air. The exposure to oxygen causes the trapped material to oxidize and turn dark, creating that characteristic appearance. Blackheads commonly appear in areas with more oil glands, your nose, chin, and forehead, the T-zone. Some people are simply more prone to blackheads due to genetics, skin type, or hormonal factors. This isn't something you've done wrong. It's just how your skin operates. The gentle approach to blackheads focuses on prevention, regular maintenance, and patient treatment, rather than aggressive extraction or harsh scrubbing. Let's explore each aspect. Prevention starts with proper cleansing. Use a gentle cleanser that removes oil and debris without stripping your skin. Cleanse once daily in the evening to remove the day's accumulation. Over-cleansing can actually worsen blackheads by triggering more oil production. For blackhead-prone skin, double cleansing in the evening can be beneficial. Start with an oil-based cleanser or cleansing balm. Counterintuitive though it seems, oil dissolves oil effectively. Massage the oil cleanser onto dry skin for a minute, allowing it to break down sebum and dissolve pore clogging material. Rinse. Then follow with your regular gentle water-based cleanser. The star ingredient for blackhead prevention and treatment is salicylic acid, a beta-hydroxy acid that's oil-soluble. This means it can penetrate into your pores, dissolving the oil and dead skin cells that cause blackheads. Use a product with 0.5 to 2% salicylic acid several times per week. You can incorporate salicylic acid through a cleanser, a leave-on treatment, or a toner. Leave-on treatments are generally most effective because they have more time to work. Apply salicylic acid to clean, dry skin and allow it to absorb before applying other products. Start slowly, perhaps 2 to 3 times per week, and gradually increase frequency as your skin builds tolerance. Some people can eventually use it daily, while others find 3-4 times weekly sufficient. Listen to your skin and adjust accordingly. Retinoids are another effective option for blackheads. They increase cell turnover, preventing dead skin cells from accumulating in pores. Over-the-counter adapalene or prescription retinoids can significantly reduce blackheads over time. Like salicylic acid, start slowly and be patient. Results take several weeks to months. Clay masks once or twice weekly can help absorb excess oil and draw out impurities. Look for masks with kaolin or bentonite clay. Apply to blackhead-prone areas, leave on for 10 or 15 minutes until dry, then rinse with lukewarm water. Follow with your regular moisturizer. Don't skip moisturizer, even on oily, blackhead-prone skin. Use a lightweight, non-comedogenic formula. Well-hydrated skin maintains better barrier function and may produce less excess oil over time. Now let's discuss what not to do for blackheads. Don't squeeze or pick at blackheads with your fingers. This pushes bacteria deeper into pores, causes inflammation, can permanently enlarge pores, and may lead to scarring. Your fingernails can damage delicate skin around pores. Don't use pore strips. These may provide temporary satisfaction by removing some surface material, but they're harsh on skin, can cause irritation, don't address the root cause, and blackheads quickly return. They're not a solution, just temporary cosmetic improvement with potential for damage. Don't use harsh physical scrubs with rough particles. These irritate skin, spread bacteria, and don't effectively clear pores. The particles are too large to enter pores where blackheads form. Don't expect instant results. Blackhead reduction is gradual. With consistent, gentle treatment, you should see improvement over 6 to 12 weeks. Quick fixes don't exist. Only patient, consistent care. If you feel you must extract blackheads, do so very carefully and rarely. After a warm shower when pores are softer, wrap clean fingers in tissue. Apply very gentle pressure on either side of a blackhead. If it doesn't release with gentle pressure, stop. Forcing it will cause damage. Apply a spot treatment after any extraction. Better yet, consider professional extraction by an esthetician or dermatologist who has proper tools and training. Professional extractions are safer and more effective than DIY attempts. Let's discuss complementary practices that support blackhead reduction. Steam your face occasionally before applying treatments. Hold your face over a bowl of hot water for 5 to 10 minutes with a towel over your head to trap steam. This softens the contents of pores, making them easier to clear with topical treatments. Don't overdo it. Once or twice weekly is sufficient. Use a konjac sponge for very gentle physical exfoliation during cleansing. These soft, plant-based sponges provide mild texture without harsh abrasion. Replace them monthly as they can harbor bacteria. Consider oil cleansing or facial oils for your skin type. Jojoba oil, for instance, is structurally similar to sebum and may help regulate oil production. Apply a few drops to damp skin and massage for several minutes, then rinse or wipe gently with a warm cloth. Lifestyle factors affect blackheads too. Manage stress, which can increase oil production. Stay hydrated to support overall skin health. Eat a balanced diet. Some people find that dairy or high glycemic foods worsen their blackheads. Keep your phone, pillowcases, and anything that touches your face clean. These can transfer oil and bacteria to your skin, contributing to clogged pores. Be patient and consistent. Blackheads didn't form overnight, and they won't disappear overnight. With gentle, regular treatment using the methods described, you should see gradual but steady improvement. Remember that some blackheads are stubborn and some level of visible pores with dark appearance is normal and natural. You're not aiming for magazine perfect skin. You're aiming for healthy skin with minimal congestion. As we close, embrace this truth. Gentle methods work better than harsh ones for lasting blackhead reduction. Patience, consistency, and kindness toward your skin will serve you far better than aggressive extraction or stripping treatments. May your skin clear gently. May you find patience for the process. May you treat your skin with the tenderness it deserves.